Thank you for the introduction, Professor Dr. Muhammad. It's my pleasure to be here in Ain Shams Radiology Conference. So I'm going to present today why do we need lutetium PSMA therapy. I'm going to divide this talk into three parts. The first part is to understand what is lutetium PSMA. The second part will be about important literature using lutetium PSMA, and the final section will be about real case examples. So let's start by the first section. What is lutetium PSMA? The simple answer, it is an intravenous radioactive therapy, and it is used to treat metastatic cancer prostate patients. That's the simple answer. So now why do we need it? So this is a simplified curve showing the prostatic patient's life cycle. So patients start by having a localized disease where they take local therapy, then the PSA decreases and the prostate is removed or treated so the tumor burden decreases. Then unfortunately, after some time, 30 to 40% of the patients can develop later on recurrence or metastasis, and then we can see the curve rising back up. We can see increase in PSA level and increase in the tumor burden. At this stage, we start hormonal treatment, which is very effective in controlling the disease. Now we can see the slope going back down again, the PSA decreasing, and the tumor load is decreasing. Of course, we have several lines of hormonal treatment. This is just a simplified graph to understand the idea. Then, unfortunately, after a certain period of time, resistance develop. And then the tumor markers of the PSA begins to re-elevate again. The tumor begins to re-elevate, and then we have this upslope where we reach here, and then we move to the chemotherapy. Again, we have several lines of chemotherapy which can control the disease, and then we can see the PSA decreasing and the tumor burden decreasing again. However, unfortunately, again, resistance develop. The tumor becomes rising again, progressive slope, the PSA increasing until, unfortunately, death. And that is exactly why do we need lutetium PSMA, to intervene at this step and try to reverse the process again. We want the slope to reverse back downwards. We want to control disease progression, and we want to give patients more time. That's the main value of lutetium PSMA. Now let's see how it works. So cancer prostate cells have a specific receptor on their surface, which is called PSMA receptor, which is short for prostate-specific membrane antigen, which is specific to cancer prostate cells. So now we inject lutetium PSMA, which is injected intravenously. It goes into circulation, and it targets these specific receptors. Then lutetium emits beta radiation inside these cells, causing cytotoxic cell death. So the mechanism of action is very simple, very straightforward. We are targeting prostate cancer receptors. Now let's see why are we using lutetium. Lutetium isotope has two very important physical properties. The first important property is that it emits short-ranged beta rays. And what is the value of that? Is when the radiation goes inside cancer cells, the range of radiation is very limited, only 0.7 millimeters. And that means that we have low toxicity to surrounding healthy cells. So the side effects is very limited because the radiation will not affect healthy cells. The second important physical property is the long half-life, which is almost 7 days of lutetium. And that allows long tumoral exposure to radiation because the radioactive material does not decay early, so it keeps persisting inside tumor cells for a long time, and that allows more radiation exposure to cancer cells. Now we finished the first part. Let's move to important literature using lutetium PSMA. I will start by this article, which was published in the Journal of Nuclear Medicine, and it was titled, "Lutetium PSMA is one of the greatest success stories in the history of nuclear medicine." And this is what I will try to show you now, why this article was written. So the story began in 2018, 5 years ago. This was the first prospective trial. It was published in the Lancet Oncology. And in 2018, they had 30 heavily treated patients. So these patients finished all hormonal, finished all chemotherapy, and basically they didn't have any residual lines of treatment left. And the results of this study were extremely significant, that it won the Image of the Year in 2018 from the Society of Nuclear Medicine. Now let's see, what do we see in the Image of the Year? We see 8 different patients. Each square is one patient. So this is patient number 1, that's patient number 2, and that's patient number 3, and so on. So in each square, we have a pre-therapy scan. This is a PSMA PET-CT showing all the red dots in the body. That's metastatic lesions occupying most of the body. And you can see below, that's the PSA level, the 970. So this is before therapy. And then the image on the right side is the PSMA after therapy. You can see a resolution of most of the lesions, and you can see marked regression in PSA level, declining to 7 from 970. And you can see the same response in patients with metastatic bony lesions, with metastatic nodal lesions like this one, and also this patient, and also in patients with hepatic deposits. So the results were extremely significant. And they concluded in this study that lutetium PSMA has high response rates, more importantly, low toxic effects and low side effects, and leads to marked reduction in bony pains and improves quality of life. And again, that's in patients with hormone-resistant prostate cancer that progressed after hormonal and chemo. So they didn't have any basically residual lines of treatment left. So after the positive results of this study, they wanted to do a bigger study to try to take FDA approval. So they did the VISION trial, which was published in the New England Journal of Medicine, and they enrolled a much larger number of patients for the FDA approval. And that was a randomized phase 3 trial. It was performed on 830 patients, and the results of this trial were positive. Lutetium PSMA improved the progression-free survival with 60% reduced risk for progression, and improved the overall survival with 38% reduced risk for death. And the principal investigator of the VISION trial, Oliver Sartor, said that after finishing the trial, he saw that patients who were receiving lutetium PSMA were simply living longer and living better. So I think this is the main conclusion of what we need to know about lutetium PSMA: living longer and living better. And after the positive results of this study, then lutetium PSMA was FDA approved last year in March 2022 for metastatic cancer prostate patients after hormonal and chemotherapy, and it was approved in 6 doses, up to 6 doses, a dose every 6 weeks, or until disease progression or unacceptable toxicity. Now let's move to the final section, which is real cases. So I want to start first by the pre-procedure eligibility. We have a very important role to decide which patient can benefit from lutetium and which cannot benefit from lutetium. And this is the eligibility criterion. So this is a patient that has enlarged active pelvic lymph nodes and bony lesions, and the SUV max of this patient was above 40, So this is high SUV max. So high SUV max in PSMA PET-CT, this is not FDG, this is PSMA PET-CT. It means that the cancer cells have a lot of PSMA receptors. They have high PSMA receptor expression. And what does that mean? It means when we inject lutetium, the receptor will absorb much, much more lutetium inside the cells, so we will have a better probability of good response. Now let's see the opposite. What will happen? If you have the opposite, like this patient, so this patient has hypodense hepatic focal lesions. However, the SUV max is low in these lesions. It has lower uptake than normal hepatic parenchyma. So that's low SUV, which means low amount of PSMA receptors. So when we inject lutetium PSMA, it will not be absorbed by the cells. And unfortunately, there will be no response. And that's our role, to help select the patients, to select the appropriate patients that will benefit from lutetium. Now let's move to the procedure itself. It is very straightforward and very easy. We need well hydration. We inject lutetium PSMA slowly, followed by saline infusion. And it's important to know that lutetium is an outpatient procedure. The patient reaches a safe level of radiation within 4 to 5 hours, and the patient is discharged. It's not like iodine 131, so this is the radiation emitted from the patient has a low dose rate, so it is safe that the patient is discharged after 4 to 5 hours. However, we have, of course, certain radiation safety instructions to give to the patients: to drink lots of fluid, to stay away from pregnant women and children for a few days, and of course the patient goes back to his oncologist for his routine follow-up to assess for any toxicity, for response assessment, and for any overall recommendations and feedback. Now let's move to the case number 1. So this patient had metastatic, diffuse metastatic bony lesions, as well as pelvic lymph nodes, seen here. So the patient received actually 2 doses of lutetium, and now that's the post-dose assessment. We can see resolution or regression in most of the metastatic bony lesions, and the resolution of the pelvic lymph nodes, seen here. And the PSA dropped almost 94% from 2 doses. Moving to another case, again, widely disseminated bony metastasis occupying all the skeleton and large pelvic lymph nodes, seen here. And this patient actually had extremely high SUV. This patient had almost above 70 SUV. And this patient received only a single dose, which had a remarkable improvement in regression of the lesions and a remarkable improvement in the quality of life of the patient. And you can see, of course, the lymph nodes almost totally disappeared. And again, PSA regressed by almost 98%. Now the final case, again, the same concept, patient with high, the darker the color of the lesions, it means that the higher the SUV. So when we compare the lesion with the liver, we can see that the lesion has much higher uptake compared to liver. It means that it has higher SUV max. I put this image to show you this rib lesion with extra osseous soft tissue component that is pushing the liver, as you can see it here. And this patient received 3 doses, and in the follow-up, the soft tissue component of this bony lesion almost totally disappeared. So we have also, again, subjective response with tumor shrinkage. And the PSA dropped almost 76% in this patient. So my final remarks and take-home messages: lutetium PSMA is FDA approved for treatment of metastatic cancer prostate patients. It has high response rates with very acceptable side effects. And finally, it leads to marked improvement in quality of life. Thank you very much.
دكتور يحيى for your nice elaborated presentation. وكنا يعني بصراحة دي future applications يعني بتاعت اللوتيشيوم، ف it's very nicely presented. Thank you so much. دكتور محمد يسأل حضرتك حاجات بسيطة، بس يعني بنقول لحضرتك
دكتور محمد
احنا بس عندنا الجلسة الافتتاحية بتاعت المؤتمر، دكتور محمود المتيني ودكتور علي الأنور ودكتور طارق يوسف في انتظارنا، بس نسأل سؤالين كده.
سؤال بس، انا بشكر دكتور يحيى ان احنا كنا سابقين ماني كانترز ان يوروب. احنا البي اس ام اي كان دخل في المانيا از بي اي، وكنا 2018 كان الناس في جوستاف بينكروا اللوتيشيوم، واليوروب بيقول لك لا ما فيش لوتيشيوم خالص، في ريديوم. واحنا كنا وقتها يعني دكتور يحيى انقذ حالات كتيره من عندنا. هي تريتد وين نو تريتمنت اوبشن، وفعلا عملنا حالات كتيره جدا جدا. وجه كريم فيزازي بعد كده في 22 سنه اللي فاتت ابروفد اللوتيشيوم از ا موداليتي اوف تريتمنت وين نو تريتمنت اوبشن فور كانسر بروستات. ثانك يو دكتور يحيى.
الحقيقه برضه انا لازم اقول ان حضرتك من اوائل الناس اللي يعني صدقت الفكره
5 سنين فاتوا
بالظبط.
كنا وقتها بنقعد
الموضوع ده من يعني
كنا بنقعد مع الخبراء الفرنساويين يقول لك لا نو لوتيشيوم ذير از ريديوم، بس كان الاكسبرت الوحيدين كانوا في جيرماني، وكان بروفيسور هوفمان هو اللي كان ماسك البي اي بتاعت اللي هي 2018 دي. سيدي حضرتك اشتغلت معاه في نفس التوقيت، وصراحه ارفع لك القبعه.
شكرا جزيلا. شكرا جزيلا ان حضرتك صدقت الفكره من زمان قوي كده.
ممكن اسال سؤال؟ يعني نسبه الحالات اللي بتيجي عشان فور لوتيشيوم يعني انجكشن قد ايه؟ يعني از ات بوبيلر دلوقتي تريتمنت ولا لا؟ وهل كده كده العيان هيجي له ريكارنس؟
هيجي
كده هيجي له ريكارنس
باي سيرتن تايم، هيحصل ريزيستنس اجين زي ما حصل ريزيستنس مع كل البريفيوس تريتمنتس. هيحصل ريزيستنس مع اللوتيشيوم. دلوقتي الايديا ان بقى في سكند لاين راديو اكتيف ثيرابي بعد ما اللوتيشيوم بقى في اكتينيوم بي اس ام اي، ده الفا ايميتر. فده النكست ستيب. بيجي قد ايه؟ مشكله ان هو اتس فيري اكسبنسيف. الدوز الواحده تقريبا دلوقتي ان هو بالدولار تقريبا ب $6000 $5000 وشويه. فاتس نوت ايزي، مش كل البيشنتس تقدر تدفع الفلوس دي
طبعا.
فاتس ا بيج بيردن على الفاينانشال بيردن يعني، فاتس نوت ايزي يعني.
تمام. ثانك يو. شكرا جزيلا، وبشكر كل السبيكرز وبشكر كل الضيوف.